Good morning, everybody. I'll really all jump on here. I had such good remarks from my hair getting so long that I decided not to slick it back today. So this is what I look like when I get up. Well, not quite. If I showed you what I looked like when I got up, you would run screaming from your screens. But it is brushed. And here's the kitty coming down the stairs to my left. Okay, so what we're going to do today, apparently I like to do sort of controversial things. So we're going to talk about CBD today. This one I've written up. I wrote it about 6 months. Well, last fall I wrote this. Put it on Medium. It's hard to share on Facebook, but I'll put a link up later when I get done. And we'll that way you can read it. Because this article that I am referencing that I wrote is cited. So there's references that are cited. Good morning, Eileen. So the references, most of them are from the National Institutes of Health, and they will lead you directly to where I got this information and how I put it together. So CBD has not been in the news like it was. Hey, Ross. So CBD is kind of fallen off the screen fallen off everybody's radar with all the other things going on. But CBD has some pretty interesting developments. And now that, hey, morning. Now that, hey, Steph. Now that the United States allowed legal growth of hemp, there's lots of studies going on. Hey, Linda. Hey, Wendy. So there are actually, we keep hearing about double-blinded, randomized, placebo-controlled studies. Well, until 2018, that really wasn't going on. So in 2018, the Farm Bill allowed hemp to be grown legally in the United States. Not saying it hasn't been grown illegal in the United States and used for, however many years that you go back. So that that you go back in history. And the development of the illegality and Category 1 placement of THC marijuana in the history of the U.S. and how that came about is very interesting. If you haven't looked it up, do that, because it's amazing how this story on marijuana has developed over the last 90 years, almost 83 years. I think it was made illegal in 1937, but there was a federal tax on marijuana until 1979, I believe. Federal tax, even though it was illegal. So it is still listed, marijuana specifically, on the federal level as illegal, and it is a Category 1 drug by the FDA. So it's considered a dangerous and controlled substance and still illegal on the federal level. I think we're up to 28 or so states that have marijuana as a legal entity. Okay, so first thing to know is, what is CBD? Hey, Ross, that's true. Difficult in law enforcement and testing. Of course, now they're doing breathalyzers for THC, supposedly. I don't know how long or how accurate those are, because the alcohol ones are not accurate. Lots of people go to jail for breathalyzer testing, and that is based on, the breathalyzer test is based on Henry's Law. And maybe I'll do one of these on the breathalyzer test coming down the pike, because that's an interesting story as well. So CBD stands for cannabidiol. Okay, so it is part of the endocannabinoid system. Hey, Stacy. And the endocannabinoid system is, they used to think was just in your brain and kind of in your immune system, but it turns out you have endocannabinoid receptors all throughout your body. Okay, so cannabidiol is one of the major endocannabinoids of the endocannabinoid system. Okay, and I'm probably going to trip over some of these words because they are somewhat difficult to pronounce in a way. Okay, So the one that everybody knows about is THC, tetrahydrocannabinol, and that is the psychoactive substance of the cannabis plant. So without THC, there's no psychoactive capability, and there are 100 endocannabinoids. So marijuana is a cannabis plant called Cannabis sativa, and then that contains THC as well as cannabidiol. Hey, Andrea. Okay, so CBD is in marijuana. Okay, CBD or hemp is a cannabis plant that's called Cannabis sativa. It also has THC. So in Cannabis indica, the main cannabinoid, and somebody probably argue with me, but the psychoactive cannabinoid is THC, and I think it's the main one in that plant. So Cannabis sativa has small amounts of THC. Okay, so there lies the controversy between the medical marijuana people and the CBD people. So the marijuana people think or believe that the THC component of Cannabis indica is the medically active part of these plants. Hey, Craig. Hey, Jill. Okay. So, in other words, CBD in Cannabis indica can only reach its full potential if it is synergistic or works together with THC. Okay, the CBD people, or specifically the hemp people, so the Cannabis sativa plant, believe that also, however, in a hemp product, not just CBD, a hemp product to be legally sold in the U.S. Is 0.3% THC. So it's a little teeny amount, but it's still synergistic. And a hemp is basically a full spectrum product. So if you're just buying CBD, you're just getting CBD. And in order to extract, so a CBD extract, here's the chemistry part of it, the CBD extracts have to be put through a gas chromatographer in order to strip the CBD out of the compound or out of the hemp. And then the terpenes, which are needed for the activity of CBD, have to be added back in. So a full spectrum hemp product doesn't have to do that. Okay, so to understand the possible therapeutic effects of CBD, it's important to understand the endocannabinoid system. And so what is that? The endocannabinoid system is a lipid signaling system that's in your body anyway. So all you're doing is activating a system in your body, or helping that system do what it's supposed to do. Okay, so cannabinoid receptors and enzymes are involved in using or in the function of the endocannabinoid system itself. Okay, it's present in the central and peripheral nervous system. Okay, so the whole system is present there, and I told you that it's also been found in the immune system. But as they study more and more, it's been found in the heart, the intestines. It's involved in immunity, the autonomic nervous system, which regulates your blood pressure and your heart rate and all that. And then the microcirculation, so the endothelial cell circulation at the capillary level is affected by the endocannabinoid system. Okay, there's two main receptors for the system. They're simply called CBD1 and CBD2. Okay, so type 1 receptors are found in the brain. They regulate emotional responses. Morning, Brett. They regulate your sexuality, reproduction, and maintenance of homeostasis, which is the definition of physiology. So homeostasis is the normal balance that your body needs in order to be healthy and to function appropriately and at peak efficacy. Okay. The type 2 receptors, mainly in the immune cells, but also expressed in the heart, the gastrointestinal tract, the liver, fat tissue, and the reproductive system. Okay, so the two main ones that we talk about in the endocannabinoid system, hey Maggie, are what we're talking about, cannabidiol and THC. However, the other two, and I'll trip over this word even though I have a chemistry degree. So the other two common ones are amantadine, that one I won't trip over, and 2-arachidonoyl. I should have checked the pronunciation on Google, but it's 2-arachidonoyl glycerol, 2-AG. Okay, they're produced, this is the interesting thing about cannabinoids. They're produced on demand, so they're not running around your body just hanging around. Okay, so they're produced on demand if they're needed. Hey, Jim. And then once they're needed, they just go away. They're metabolized. Okay, so they degrade after exerting their influence. So kind of a handy little deal. Kind of like nitric oxide, and we'll talk about that here in a little bit. But nitric oxide is a potent vasodilator that's made in the cells of your vascular system when it's needed. So it'll dilate your blood vessels and then just go away. Okay. Okay, so the pathology of disease, most of which I've told you, hey, Leslie and Paula, is chronic inflammation, right? Pretty much the basis of a lot of disease if you take the genetics out. So a lot of chronic illnesses are chronic inflammation based. And so the research is being done on CBD to see how it affects chronic inflammatory conditions and what it can do to potentially help with these diseases. Okay, notice FDA disclaimer again. These statements have not been evaluated by the FDA, and I'm not suggesting that CBD treats or cures anything, but it may help certain conditions. Okay, so what I'm going to do is talk about the conditions that research has been done on CBD, THC, and the full hemp spectrum products. Okay, and these are all cited in this, and I'll put it up. I'll put you a link where you can read this whole thing with all the links, and you can look it up for yourself. A lot of scientific jargon, but if you like science, which I know some people on here that I'm looking at do, you'll enjoy reading about this. So modifying the endocannabinoid system with CBD and hemp products is based on the fact that the receptors seem to be more active or less active, usually less active, in disease states. Okay, so modulating the endocannabinoid system is the point of using CBD and hemp and THC. Okay, so we're going to talk about, I've got this whole list, but rather than read you the list, I'm just going to go through the list with the kind of more detailed stuff. Okay, so CBD and cancer. My father and mother both died of lung cancer 5 days apart in December 2018. My mother refused treatment, probably after watching what my dad went through, but CBD and basically there is a medical marijuana pill that he was prescribed by the VA. He also used full THC infused oil. And that seemed, pain was not a big deal till he was later. It took about 1 year and 4 months for him to succumb to lung cancer. And he was an asbestos worker and had lung cancer in 2010 and had surgery, and it came back and it was inoperable at that point. But THC and CBD oil and medical marijuana pill really seemed to help with his discomfort. Okay, he also had no appetite, so the THC helped with his appetite. So he had lost, I don't know, 60 or 70 pounds by the time he died. Okay, so THC is fairly well established with cancer pain, and he was never really in a lot of pain because he pretty much took his THC. Okay. So the data on the anti-cancer benefits of CBD, however, has been kind of controversial. So it's not something that everybody thinks, ooh, this is going to work, it's going to prevent cancer, it's going to treat cancer. There are some cancers where the CBD system and the endocannabinoid system are actually upregulated. So the receptors are upregulated and may contribute to the development of certain types of cancer. Okay, so inflammation and destruction of the immune system. So you get cancer because your immune system cannot keep up with the transformations that are going on within whatever tissue is trying to become a neoplasia. So neoplasia means new growth. Doesn't always have to be malignant. So there are benign neoplasias like fibroids in women. And then there's malignant neoplasias like lung cancer and breast cancer and all that. Okay, so upregulation has been seen in the CBD receptor system of some cancers. And other reports indicate that upregulating or activating the endocannabinoid system can help prevent cancer from taking hold and developing and taking over the tissue. Okay, so the main effects seem to be inhibition of tumor cell growth and causing cancer cells to commit suicide. The scientific name for that, and it's kind of ingrained, you get a new stomach lining every 3 days. So cells undergo suicide by a process called apoptosis. And apparently, in some cancers, the endocannabinoid system actually makes the tumor cells undergo apoptosis. So observable in cancers of the lung, the prostate, the pancreas, the breast, the cervix, and gliomas of the brain, which is the most studied one, gliomas of the brain for the endocannabinoid system, okay? Also effects on the immune system from CBD that may involve the CB2 receptor. I think I said CBD earlier, it's CB1 and CB2. So the CB2 receptor is the immune system one, okay? So the immune system moderates or modulates growth and development of many types of cancer. So if your immune system can't keep up with what's going on, then the cancer cells take hold. Okay, so the immune system, and we talked about ways to boost your immune system over this pandemic thing 2 weeks ago. So keeping your immune system, which goes, that goes south after you get a certain age, is one of the keys to preventing chronic illness, right? Okay, CBD and seizures. This one's interesting. So CBD has been used in seizure disorders for almost 5,000 years. Okay, the first studies on cannabis use in seizure disorders were done in China 2,700 years BC. So we're almost at 5,000 years for looking at the effects of CBD on epilepsy. Okay, and of course, this is the one that's explosive in research because it's been around so long. So now that it's legal to grow hemp here, that research is being done. And there's finally, you remember, we keep hearing about evidence-based treatments, placebo-controlled, double-blinded, randomized studies. Well, there's 3 on CBD and epilepsy. CBD in low doses, very low doses, seems to reduce seizure activity in epileptics, so people with seizure disorders. And probably you've seen videos of people putting CBD on kids' feet that are having grand mal seizures, and they decline and stop seizing 30 seconds later. Are they staged? I don't know. But there is, hey, good morning, Brandy. And there are 3 studies, double-blinded, randomized, placebo-controlled, okay? And they're thinking that fairly soon, how studies go, it takes a while, you're going to have evidence-based treatment recommendations for seizure disorders in the United States that are FDA approved, okay? Okay, chronic pain syndrome. Well, what is that? Well, that goes to the opioid epidemic. Hey, Scott. Okay, and I do have another talk we'll do on the opioid epidemic because I gave this talk at a national convention in Cincinnati a couple years ago since I was doing addiction medicine in Oklahoma City. Hey, Holly. So opioid use disorder is kind of the overall kind of term, and we talked about media bias, and everybody that's, a lot of people think that everybody that's on a narcotic with chronic pain syndrome is an addict, and that's not true. A lot of doctors don't even understand that. So the amount of Americans with chronic pain is estimated at 19-20%, so 1 in 5. Okay, and the definition of chronic pain syndrome is pain that lasts for 3 months or longer, or pain that is past the normal time of tissue healing, like for surgery patients, or if you get an injury or traumatic injury. Okay, so approximately 25% of people that have acute pain will go on to have chronic pain syndrome, where they need something to treat it. Let me see. Hope you guys can't see that. My PDF is doing something. Okay, in the past 20 years, opiate medication use has skyrocketed for management of chronic pain syndrome, and it does lead to dependence. That doesn't mean addiction. Okay, so the distinction is that anybody that's on chronic opiate use, even the illegal ones, is dependent. Okay, so that doesn't mean they're addicts. So all addicts are opiate dependent. Okay, but addicts, people that are addicted to opiates, use them compulsively, and that's really the differentiation. So a person with, when I was doing pain, patients that had chronic pain syndrome, fibromyalgia, whichever, would get their medication, and then they would come back every 28 days like it's required, and they would still have 2 days of medication left. The opiate addict people are compulsive, that they will take their entire month's worth of pain medications in less than a week, and then they're out looking for ways to get that in an illegal way. Okay, so treatment resistant pain conditions seems to be responding to an endocannabinoid system deficiency. Okay, so theoretically, if you stimulate the endocannabinoid system, your chronic pain syndrome should get better. So that's been shown in migraines, fibromyalgia, and irritable bowel syndrome, and intestinal pain. Okay, so irritable bowel syndrome I keep hearing about. I'm not a GI doctor, so I didn't really see that much. But the endocannabinoids seem to really help with irritable bowel syndrome and inflammatory bowel conditions as well, and intestinal pain in general. Okay, it also seems to reduce the inflammation that's associated with chronic inflammatory pain syndrome. Okay, so they are 10 times. This is interesting, and if I put this up, you'll see. You can go right to it and read it. I'm going to read it to you directly like I wrote it. The cannabinoids have been shown to be 10 times more potent than morphine in the neurons that mediate pain from the thalamus of the brain. And the thalamus of the brain is kind of like the relay station for your nervous system. Almost, not all, almost every nerve, specifically pain ones, goes through the thalamus before it reaches the cortex, coming from the peripheral nervous system. Okay, so having an endocannabinoid that can help with that problem at the relay station 10 times more efficiently than morphine. And of course, endocannabinoids are not, you don't get dependent on those. Otherwise, you would be dependent on your own endocannabinoid system, and nobody has that problem. We can debate THC and dependency at a later date. There are people that think that's a dependent causing drug, THC specifically, but cannabidiol certainly is not, and the other endocannabinoids are not something that you're going to get dependent on. Okay, so non-cancer patients have self-reported cannabis use. So of the 19-20% of people that have had chronic pain syndrome, interestingly enough, only 6% have tried or used cannabis products to help with their chronic pain syndrome. So there's a big, wide amount of people that have never tried that. And it doesn't work for everybody. I heard from a guy last night, it doesn't work for his muscle pain. Hey, Rob. And so it does, you know, there's not a panacea of anything. There's no one little pill or whatever that's going to treat every person on the face of the earth, right? Okay, so they've been used, though, in patients that have lower back pain, neck pain, abdominal pain, knee pain, has been used successfully in multiple sclerosis patients, myofascial pain, infection-related pain, arthritis, stroke, trauma, and post-operative pain. So a lot of research going on. Hey, Stace, Ham. A lot of research going on chronic pain syndrome. Okay, what about heart disease? Okay, so we focus on cholesterol levels in heart disease, and I told you Friday that we're going to talk about cholesterol and U.S. food pyramid, and I'm going to show you how that developed on Wednesday. So we're going to talk about cholesterol lowering drugs, how they came to be, why they're used in such wide fashion, like up to 1 in 3 people on the earth potentially, or I think, are taking Lipitor-like things. So we need to talk about that. We'll talk about that Wednesday. So what can the endocannabinoid system do for heart disease? So specifically, when you say heart disease, that encompasses any problem that comes up with the heart, right? And most of this has to do with atherosclerosis, which is commonly known as hardening of the arteries. Okay, so the focus has been cholesterol. The real reason for heart disease and coronary artery disease specifically is chronic inflammation of the internal wall of the blood vessel. That's been shown by surgery. There's a guy that left a 25-year surgery career doing coronary artery bypass grafts, and he described coronary artery disease, other than looking at plaques and all that. He said it's like somebody took a wire brush to the internal lining of the blood vessel. That's what makes things stick to it. Because you remember, cholesterol, you need cholesterol to be alive, and 80% of your cholesterol you don't eat, you make it in your liver. Okay, so if cholesterol is the only culprit, then we would all be having chest pain, angina pectoris, and heart attacks all the time, because 80% of our cholesterol we have no control over at all. Hey, Dr. Brooks. Okay, so really, eventually you get you get the damage to the blood vessel, you get plaque, and eventually you get a blood clot, and the blood clot is the heart attack. Okay, still the leading cause of death in the U.S. is cardiovascular disease. Okay, so functional medicine, which is what I was practicing until I quit in 2017, really looks at the cause of disease and how you prevent it in the first place. So the whole idea should be for healthcare to prevent you ever having to see a doctor unless you've got something, like a gunshot wound to the head or whatever, or you broke something. So you can control chronic inflammation. You can control your cholesterol levels, and we'll talk about that Wednesday again. You cannot control your family history, which is probably 25% of the risk of cardiovascular disease. Okay, but if you could prevent it, that would be handy. And I'm getting the blood pressure, Rachel, I promise, because I take CBD to help with my blood pressure, amongst the other pharmaceutical things that I have to do. So what you're doing is positively influencing the response of your heart to stress. And that's a whole nother thing we can talk about, stress and what it does to your body in general. Okay, it also influences the lifespan of white blood cells, CBD, or the endocannabinoids, okay, and platelet aggregation. So those are two hallmarks of inflammation, not the only two, but two of them, that can lead to arterial damage. And remember, that guy said hey, Jesse, it looks like somebody took a wire brush to the internal lining of your arteries if you have vascular disease, specifically cardiovascular disease. Okay, so CBD is also shown to relax blood vessels, and that may be due to increasing availability of nitric oxide, that substance that is produced by the endothelial cell itself in a blood vessel. Okay, it does its thing, it vasodilates. Apparently, the endocannabinoid system also does similar relaxation, and that's the reason, Rachel, for using it in hypertension. Okay, so I was still, even on pharmaceuticals, I was still hypertensive until I started taking CBD. Okay, and now if I don't take my meds, CBD by itself won't do it, but I'm sure it'd be even higher if I wasn't doing that, right? Okay, CBD also seems to mediate the effects of heart attack. So and atherosclerosis, sclerosis, and heart disease, like we said. So it may limit heart damaged muscle while you're having a myocardial infarction or a heart attack, because they've shown improved reperfusion of the cardiac muscle, and then reduction in the lack of oxygen, which is known as ischemia during a heart attack. So the lack of oxygen is what leads to, hey Ross, I'm going to talk about some amounts. I don't know specifically in heart disease. So where was I? Oh, reperfusion and lack of oxygen. Once your heart muscle dies, it's gone. It's dead. It's not like your stomach lining reproduces and you get a new one every 3 days. You don't get new heart muscle. Okay, so what you really want to do is avoid the damage that's occurring during a heart attack, and CBD apparently seems to help that. Okay, so what about anxiety and depression? Okay, so how many people know people that are on anxiety meds, benzodiazepines, which are horribly addictive, and depression? How many people are on depression? We talked about depression with vitamin D last Monday, and how something simple as getting your vitamin D level into an optimal level can help with that. CBD is fairly well studied with anxiety, and they do it with brain flow studies of the brain like PET scans. And so there's an alteration of blood flow. Also, hey, Christy, also alteration in people that are addicted. So addicts have different brain flows, and you can see them. There's a guy named Dr. Amen, A-M-E-N, who's done lots of brain scans. His TED Talk is fascinating. I showed it to my physiology class this semester after I ran across his TED Talk. It's amazing. Okay, so that's the kind of studies that are being done on CBD. So we also know that memories of fear with PTSD, so PTSD usually involves the amygdala and a fear response, and of course you can ameliorate some of those memories with CBD apparently. And you form your long-term memories in your hippocampus, part of your brain, while you're sleeping. And of course, if you're a PTSD person, you're not going to sleep that much, depending on what your issue is, right? Okay, so depressive symptoms and emotions in general are controlled with the amygdala itself, and that's a real basic response in your brain. The cingulate cortex, the hippocampus, is long-term memory, and the hypothalamus for the hormone content. Okay, so THC specifically, when used in anxiety, seems to be dose dependent. So what they found is little bitty doses, and this is one I'll talk about the dose, 10 milligrams per cc of whatever product you're using seems to be fairly effective. Hey, Tom. So 10 milligrams is a pretty simple little teeny dose. What they found in bipolar disorder and anxiety is if you take too much, so you have to dose dependent. Hey, Tori, if you take too much, you actually get rebound anxiety. I also found that to be true with using oxytocin, which is how I got people that were dependent on benzodiazepines off benzodiazepines by using oxytocin. But if you do too much, you give too much, like 200 international units a day, they get a rebound anxiety, and the same thing happens with CBD products, okay? But there has been effectiveness in improving reduced mood. So patients with depression apparently have that 2-AG, that arachidonoglycerol receptor. I cannot pronounce that, I don't know why. So it's worsened, so they have a reduction in those receptors, and it worsens the longer the depression symptoms or depressed affect are present, okay? And so when they get exposed to the stressors of life, so they're depressed, they actually improve their receptor count. And that helps them deal with their social phobias and the social anxiety problems that can occur with people that have depression. I always when I was practicing, I hated to put a diagnosis of depression on anybody. I always called it an adjustment disorder with depressed affect. And don't let somebody diagnose you with depression. It can cause you trouble the rest of your life. Okay, so there are seven studies that show CBD to be effective in improving moods, improving a depressed mood. Also, you have to figure out for each person, so this is that individualized thing which I was known so well for with hormone replacement. You have to figure out in each person the dose. So 10 milligrams seems to be the average. And that may be too much for some people, so you just half the dose, right? You just take half. So you have to individualize that and figure out for each person, and the person would know. I mean, you figure out where your sweet spot is, especially with anxiety and depression. Okay, what about diabetes and insulin resistance? So insulin resistance leads to type 2 diabetes. It's called metabolic syndrome. It's rampant. So I'm going to give you stats. The CDC estimates that 30 million Americans have diabetes, which translates to about 1 in 10, right? 90 to 95% of those have type 2 diabetes, which is manageable and it's reversible. Type 1 is genetic, found in childhood. It's lifelong, although they're looking at 3D printing pancreases now for potential use in type 1 diabetics who are insulin dependent forever. I have no idea how 3D printing works. Doesn't make sense to me, but they're working on it. Okay, type 2 diabetes, usually in adults, it's preventable, it's reversible. Like I said, metabolic syndrome is the state of insulin resistance. It's diagnosed with a hemoglobin A1C level of greater than 5.7. Type 2 diabetes is a hemoglobin A1C level of 6.5 or higher. You get over 10, you're risking your life, basically. Hemoglobin A1C is an average measure of how you metabolize glucose and your glucose levels over the past 90 days. Doesn't have to be a fasting test. It's kind of a cool little test to do to screen people for metabolic syndrome. Okay, so the CDC is also estimating that 80 million Americans have pre-diabetes, which is insulin resistance and metabolic syndrome. So the number of Americans that have an insulin issue is over 100 million, so that's 1 in 3. Okay, so the development of type 2 diabetes leads to oxidative stress and chronic inflammation. So there you go again. We talk about oxidative stress and free radical formation and inflammatory changes and breakdowns of cell walls. Okay, eventually you get the actual diagnosis of diabetes if you don't reverse the insulin resistance. And then deterioration continues with that oxidative stress and that chronic inflammation. And that leads to heart disease and kidney failure, strokes, blindness, leading cause of blindness, actually, amputations and premature death. So complications of diabetes is the 7th leading cause of death in the US. So what does CBD do for it? Well, it shows CBD's been shown to reduce oxidative stress and chronic inflammation, right? And also influences apoptosis, so cell death. So it'll attack a tumor, but it actually reduces your apoptosis in normal tissue, which is kind of what you want, unless that cell isn't working anymore, then it needs to apopt and commit suicide. Okay, this appears to be, with the oxidative stress management and reduction and inflammatory reduction, from the CB2 receptor, okay? And CB1 receptor activation, the central nervous system one, actually makes diabetes worse. So they're looking and researching to find something that will block CB1 receptors and activate CB2 receptors, and guess what? CBD apparently appears to be doing just that. It'll block the CB1 receptor in a glucose abnormal environment and activate the CB2. So it's downregulating CB1, upregulating CB2. And so that's they've done that on full spectrum hemp products, okay? So that's the diabetes thing. Okay, now along the same lines, we'll talk about abnormal weight gain. Okay, so more stats. On the world spectrum, it's estimated that almost 2 billion people, on Earth are overweight, 600 million of which meet the diagnosis of obesity. Okay. The diagnosis is based on body mass index, which is weight per body surface area in square meters. And so the normal BMI is 19 to 25. Anybody that's 27 or higher is overweight, and anybody's BMI that reaches 30 is considered a diagnosis of obesity. Okay, so the CB1 receptors are mainly found in the central nervous system unless you're overweight. Then it's stored in fat cells. Okay, so they're in the endocannabinoids are involved in metabolism, food intake, and energy utilization. Okay, so what does that mean? Well, what that means is fat is located in two types of adipose tissue. Okay, there's white fat and brown fat. Babies have lots of brown fat. Grown adults have brown fat here in their neck region. Okay, so that goes away as you get older. And the brown fat has small little lipid droplets and a high concentration of mitochondria. Mitochondria is the powerhouse of your cell making adenosine triphosphate, ATP, for cell metabolism that requires energy. Okay, so that's what makes it look brown. There's so many mitochondria in brown fat cells. The white fat cells are pretty much a single lipid droplet that appears white and sometimes beige, and that's for secreting hormones like leptin and also fat storage. So when your body, I keep talking about Twinkies and Twinkie trees. So when your body doesn't know what to do with what you've eaten, and it's too much sugar, it'll store it in fat or adipose tissue. So what if you could activate your brown adipose tissue, the metabolically active tissue that's adipose, and then also improve your lipid and glucose metabolism? So white adipose tissue is activated into beige. I don't think you can't get all the way back to brown, but it improves mitochondria in the adipose cells by exercise if you're cold. So people that are in cold environments all the time. And the other thing is thyroid hormone, which is one of the reasons. There's a guy in Norman, Oklahoma. I don't know how old he is, but he's been doing this for 50 years. All he does is for weight loss is he puts everybody on Adipex or phentermine, thyroid hormone, and tells them not to drink any colored soft drink. So it has to be clear, like Sprite. That's all he does. Been doing it for 50 years. Okay. So CB2 receptors been found to trigger enhanced browning in fat tissue, and that produces heat. And then blocking the CB1 receptor has the same change. So kind of like the diabetes thing, if you can upregulate the CB2 receptor and downregulate the CB1 receptor, that helps in weight management. Okay. So THC, well, I'm not going to say I know this, but I've heard that THC makes you eat lots of food. Well, THC has a strong affinity, and it actually binds to a CB1 receptor, and that increases appetite and fat storage. CBD or the hemps, the other endocannabinoids, have no affinity and do not bind the CB1 or CB2 receptor, and it influences their activation indirectly to get the appropriate endocannabinoid system response. Okay. So as far as weight management drugs, there's 6 that are approved by the FDA. Every one of them, I've not taken them all, but I've certainly had enough patients that do it. Every one of them has all kinds of nasty side effects. The only one that's approved by the FDA in children with weight problems is orlistat. Here's the side effects of orlistat. Oily stools, flatulence, GI discomfort, fecal incontinence, vitamin deficiency, damage to the liver, damage to the pancreas, and damage to the kidneys. So if you can activate a CB2 receptor and deactivate or downregulate a CB1 receptor, that seems to be way more safe. And really, I'm not going to say that I've had patients or clients or whatever tell me that they took CBD and had horrible side effects. I've heard them say it didn't work. Then we start talking about doses. Okay, so how do you figure out CBD and how you should use it? because it's all over the map on doses. I told you that 10 milligram dose in seizure disorder and the 10 milligram dose in anxiety seems to work at very low dose. Okay, so the research is promising. It's in infancy. Okay, it's only been legally grown in the U.S. since 2018. Okay, so when you start using CBD, or if you want to, you start with low doses and work up in increments. Okay, there's a friend of mine down the street has a store. She has doses of 10 milligrams per cc oil all the way up to, I think, 145 milligrams per cc. And she has like 6 or 7 of them in between. Okay, various pricing on that. The most expensive being the 145 milligrams per cc. And I think that's $175, I think. So her costs are like $25 to $175 total retail. Okay, especially so dose related with mental health issues and seizure disorder. Chronic pain syndrome may require a much higher dose per person, but again, there's a sweet spot. There's almost always a sweet spot. The other thing you got to do, and we talked about this with vitamin D, a lot of people think they're taking 10,000 units of vitamin D and they're taking 1,000. Both of those capsules look the same. They're little yellow things that have oil in them. So you do have to read a label, same with CBD, and it gets confusing. Okay, so a typical starting dose for CBD of whatever you're taking is 10 milligrams. Okay, so look, compare, treat up based on CBD strength and whatever's in the oil, the cream, or the edible that you're using. Okay, you're probably better off using a full spectrum product because CBD extract is just cannabidiol. The hemp products are all 100 endocannabinoids. So you probably get more bang for your buck. Okay, the hemp products have THC for synergy. Okay, it's called the entourage effect of all the CBD, all the endocannabinoids working together, and THC is part of that. Hey, Ron. Okay, so the hemp product is 0.3% if it's sold legally in the U.S., and then there's some states where you have medical marijuana, so you can get the whole shebang, right? Okay, there are many medications involved with the cytochrome P450 system, including CBD. So the cytochrome P450 system, you have to remember everything you put in your mouth goes through your liver, right? Food, meds, vitamins, alcohol, aspirin. Well, take that back. Aspirin does not. So the only two things that are absorbed from your stomach are aspirin and alcohol, right? Everything else is going to go through your liver. And so meds specifically are managed with the cytochrome P450 system. Hey, Tammy. And the cytochrome P450 system, of course, if they're both being used, you have to look at interactions. It's kind of difficult. I've tried. It's kind of difficult to find medications that list an interaction with the endocannabinoids, but you do have to think about it. And you may have to adjust your dose with your doctor and, help with them say, okay, I'm doing this and this is, I'm doing when I played around with CBD and my medications, I just notified my doctor what I was thinking about doing. And he either agreed or he had the right to tell me don't do that. Okay. I have a medical background, so I maybe know a little bit more than some people, but playing around with dosing is kind of important. I mean, individualized dosing is important. So I take some of my meds and cut them in half, and I play around until I got something that worked for hypertension in addition to CBD. Okay. And then make sure your quality of your product is good. Okay. So you can get Ralph's CBD at the gas station, right? It's cheap. It's probably cheap for a reason. So expect to spend probably $50 to $150 depending on what you're getting. It shouldn't be cheap. It should sting just a little bit. Okay. And most of these will have a certificate of analysis and they've sent their product off to an independent, unbiased lab so that they know they can evaluate what's actually in there. So if you're taking a CBD product that doesn't have that, they can just sell you oil, right? I mean, I can sell you olive oil and tell you there's CBD in it, and then a lot of people will say, well, that CBD didn't work. That CBD oil didn't work. Well, what kind, what product, what company, did it have certificate of authenticity, et cetera, et cetera. So a high price may not guarantee quality, but if a CBD product is cheap, it's probably cheap for a reason, because there might not be anything in it, right? Okay, so I will put this up. I do have a link that I'll put in the comments when I get done, where you can read this, and it has the links to the articles and the research that I did to write this and give you this talk. So I did it shorter than I usually do. So I give this talk in public, and it usually takes me an hour-ish. So we did it in 49 minutes. So, and that was with me blabbing on top of what was in there. So, all right, so 9:30 Wednesday, we're going to talk about cholesterol, the history of cholesterol-lowering drugs, and the U.S. food pyramid and how that came about. It's very interesting, and I learned a lot doing this one. So have a great day. Peace and health to all of you. Try your CBD. If you want help picking one, send me a message, and I'll put this article up by noon, okay? All right, see you Wednesday. Have a great day. Bye.